Hi everyone, and welcome back to the channel. If you're looking for help at home for yourself or a loved one, you've probably run into two terms that seem to mean the same thing, but don't. Home care and home health care. The confusion around these two terms is one of the biggest roadblocks families face when starting the process of arranging care. You need to know the correct terminology because it directly impacts the services you get, who provides the care, and most importantly, how you pay for it. In this video, we're going to completely demystify the difference between home care and home health. Let's start with the one that's strictly medical. What is home health care? The medical side. So what exactly is home health care? The easiest way to think of it is this. Home health is skilled care. This means it is a medical service that requires a professional license to administer. It is always ordered by a physician. You need a doctor's prescription for it. Home health is also generally short-term and intermittent. The goal is to get you well enough to no longer need the skilled care. What services fall under home health? Skilled nursing. This includes things like managing IVs, changing catheters, or administering complex medication. Wound care. Professional dressing and management of surgical wounds or ulcers. Therapies. Physical therapy, PT, occupational therapy or OT, or speech-language pathology, SLP, to help with mobility, daily tasks, or communication after an event like a stroke or surgery. What is non-skilled home care? That's the support side. Now let's look at home care, which is often referred to as non-medical home care or personal care. This is the opposite of home health. It is unskilled care. Home care is focused on aiding with what we call activities of daily living, or ADLs. This care is typically long-term and aims to help a person age in place safely and comfortably. You do not need a doctor's order to start home care. What services are included here? Personal care, assistance with bathing, dressing, grooming, and toileting. Homemaker services, light housekeeping, laundry, and meal preparation. Companionship, social interaction, and mental stimulation. Medication reminders. Note, they can remind you to take the medication, but they cannot administer it. That's a home health service. The biggest difference? Who provides care? This is the most crucial distinction, and it comes down to credentials. The care provider is the key difference when comparing home care versus home health. For home health, your team consists of licensed medical professionals. We're talking about registered nurses, RNs, licensed practical nurses, or LPNs, physical therapists, and medical social workers. They are operating under a doctor's plan of care. For home care, your provider is typically a home care aide or a personal care assistant. While they are trained, background checked, and often certified to assist with personal care, they are not licensed to perform medical tasks. This is why a home care aide can help you get in the shower but cannot change your wound dressing. How is each type of care paid for? Medicare versus private pay. The cost and payment options are where families see the largest financial impact. Home health care is usually covered by Medicare, Medicare Advantage, or private insurance. However, there are strict criteria. You must be certified by a doctor as homebound, the care must be medically necessary, and it must be intermittent, meaning only a few times a week and for a defined period of time. This is not for permanent round-the-clock support. Home care is typically private pay. Because it is not medical, insurance rarely covers it. The common payment sources include out-of-pocket savings, long-term care insurance policies, some limited state or county Medicaid programs. Because it's private pay, you control the schedule and the duration. You can have an aide for 4 hours a day, 7 days a week, or even 24/7. Do you need home health and home care? A common question we get is, can I have both? And the answer is a resounding yes. In fact, having both is often the ideal scenario, especially after a hospital stay or a new diagnosis. Think of it this way. Home health comes in for an hour 3 times a week to change your bandages and teach you how to manage your medication. Home care is there every morning for 4 hours to make you breakfast, help you bathe and dress, and keep you company. They work together. The home health nurse addresses immediate medical need and recovery, while the home care aid provides the stable, daily personal support you need to stay safe in your home. To summarize the crucial difference, home health is medical or skilled and short term. Home care is supportive, unskilled, and long term. Always ask the agency, are you licensed to provide skilled care or non-medical personal assistance? This one question will clarify everything. If this video helped you understand the difference between home care and home health, please hit that like button and subscribe for more essential guides on senior care. We've linked to more resources in the description below. Thanks for watching. If you are considering home care in the Twin Cities metro area, please contact our friendly staff here at CareBuilders at Home, Minnesota. You can reach us at 612-260-2273, and we would be honored to help with care for you or your loved ones.